The Better Medicare Alliance does important work to educate and advocate for Medicare Advantage, and we want to be a part of that effort because Medicare Advantage is so important to our seniors and disabled. So we are proud and strong allies with BMA, and will be into the future. Medicare Advantage is a critically important program to seniors and the disabled. 70% of all new seniors are signing up for Medicare Advantage because they see the value. It looks like employer coverage that they used to have and provides comprehensive benefits and coordinated care that is so critically important for good health and good outcomes. An important fact to know about Medicare Advantage is that the profile of a typical enrollee is that they're lower income, compared to the general Medicare population, and they're also more diverse. And that means that Medicare Advantage plans are engaged in specific outreach strategies for those different populations who may be more difficult to reach. It involves strategies like engaging community pharmacies where there might be physician shortages. It also involves health literacy and patient engagement tools, and it involves culturally and linguistically appropriate resources. And that's important because we see higher rates of disease in those populations, and so they're more difficult to manage. But Medicare Advantage plans are kind of taking that challenge head on, and at the same time, really building in tools around social determinants of health. And there's been some recent flexibility built into the program around that. And so we see these kind of innovative strategies from some of the Medicare Advantage plans to look at housing, look at transportation, look at income, look at grocery store availability, to get at some of the root causes that are driving disease and driving costs. And again, that's important because if we can address those root causes, we can address the cost issues, and driving those costs down makes coverage more affordable at the end of the day. The movement to innovation in healthcare is being led in Medicare by Medicare Advantage. And that includes robust new benefits that aren't covered in fee-for-service. It includes coordinated care strategies, and it includes patient engagement, for difficult to reach populations that we really need to get our arms around if we're going to get our arms around healthcare costs in this country. And once we get our arms around healthcare costs, we can begin to drive those costs down. And that's important because costs are rising faster than income. And if Medicare Advantage can slow the growth rate of healthcare costs relative to income, it makes healthcare more affordable. And if we make healthcare more affordable, people can not only be happier or healthier, they can focus on other aspects of their lives that make them happier. And that leads to societal benefits across the board. So Medicare Advantage is critical in the future of Medicare generally, but it's also important to our country's health. And that's why CAHC is such a proud partner of Better Medicare Alliance, because we want to make sure that Medicare Advantage is there, not just for today, but for tomorrow, because it is the future.